Good evening. My name is Justin Otis, and I'll be presenting my art presentation for the Nursing Theory and Philosophy course for instructor Professor Dr. Alma Dixon. And I chose to do a poem, so I'll read that poem first, and then I'll just go over the description. It's titled #Supermerse. What strength I have, I leverage for the weak, doing my best to improve outcomes that seem bleak. I've seen the other side, bedbound and unable to speak, so I provide the best care I can 3 days a week. Many expect and receive spectacular service, but fail to thank, yelling into their call bell that pain meds are 5 minutes too late. Calling doctors and family, pumping chests to prevent fate. I may save 100, but lose one. Now my career is at stake. I work before I can clock in to prepare for my day. Although I am tired, work requires a 13-hour stay. The boss says, meet our goals, improve our surveys. They boast for better patient outcomes, but really, it's for pay. But once in a while, at discharge, my patient smiles and shares. You've really helped me get better. I'm so thankful you care. So as I walk to my unit, armed with prayer, I am Supermerse, fighter of sickness, hopelessness, and despair. So nursing practice is an art. Many skills and practice frameworks require fluid connection between concepts, as well as an investment of self into the medium. This art presentation consists of a poem written by myself, and it conveys my perceptions and personal nursing philosophy, that against primary negative responses, it is important to stay true to being an instrument unto a patient's healing and well-being. It is titled Supermerse because that was my nickname during my education in the associate's degree in nursing program. Halfway through the program, I was induced in a coma because of sepsis shock. I was told I died a few times, but after waking up, I knew I had purpose as a nurse. Many nurses work very hard, long hours with very little positive return from administration and patients themselves. We face situations that without careful practice and attention to detail, we could harm a patient and possibly face legal ramifications. But the times when people express their gratitude serve as a reminder that nurses do not work against patients and administrators, but rather the illnesses, emotional, spiritual, and physical, that create the need for a health caregiver to be in the patient's life. This poem represents nursing through being a patient advocate and caregiver, as well as an ambassador for the healthcare company. Health is represented by being a fighter of spiritual, emotional, and physical sickness, hopelessness, and despair. The person is represented by the nurse working long hours and being tired, but also the inspiration that comes from positive patient outcomes and personal practices such as prayer. Lastly, an environment is represented by the clinical unit and the corporate setting that the nurse also works in. Thank you. I hope I get a good grade, and have a wonderful evening.